If you are 65 or older and you have Medicare, there is a very good chance you are being denied coverage right now for care you are legally entitled to receive. Not because of your health, not because of your income, because of 6 specific rules buried inside Medicare's coverage guidelines that most beneficiaries never see, never get told about, and almost never appeal. In 2025, Medicare denied over 20 million prior authorization and coverage requests. A significant portion of those denials were overturned on appeal, but only when the patient knew to fight back. Most people don't. By the end of this video, you will know exactly which 6 coverage blocks are being used against you, what the system does not tell you, and the specific steps to reverse a denial before it costs you thousands of dollars in out-of-pocket care. The rules around Medicare coverage change every single year. CMS, the Centers for Medicare and Medicaid Services, does not send you a personal letter when your plan quietly tightens its approval criteria. What I do on this channel is track those changes, break them down in plain language, and bring them directly to you. The people who are subscribed here find out when something changes in time to act. The ones who aren't tend to find out after they've already paid the bill, sitting at a kitchen table going through medical invoices, realizing the charge was for something Medicare should have covered. Hit subscribe, turn on the bell, and let's get into it. Number 1, the prior authorization trap. Most Medicare Advantage plans now require prior authorization for procedures, specialist visits, and certain medications before they will pay for them. In theory, this is an administrative process. In practice, it is a denial machine. A 2022 Senate Finance Committee investigation found that major Medicare Advantage insurers approved 90% of care in peer-to-peer reviews, but only 18% of requests that never reached that stage got the same treatment. The difference was who knew to escalate. Here is what that looks like in real life. You have been referred to a cardiologist by your primary care doctor. You schedule the appointment. You go. The visit happens. Then 3 weeks later, you get a bill for the full amount, $780, because the referral never went through prior authorization first. Your doctor's office assumed the plan would handle it. Your plan assumed you would ask. Nobody asked. What most people don't know is that you have the right to request an expedited appeal within 72 hours if a delay in care would cause serious harm to your health. The exact process. Call your Medicare Advantage plan's member services line. The number is on the back of your insurance card, and use the words expedited grievance or expedited appeal. Write those words down. Plans are legally required to respond to an expedited appeal within 72 hours. Standard appeals take up to 60 days. If your plan denies the expedited appeal, you can escalate immediately to the Qualified Independent Contractor, or QIC. Call 1-800-MEDICARE. That's 1-800-633-4227 and request an independent review. Almost nobody uses this path. Almost everybody should. Number 2, the Skilled Nursing Facility 60-Day Gap Rule. Medicare Part A covers skilled nursing facility care, but only under very specific conditions. And the one condition that catches people hardest is the benefit period reset. Medicare's benefit period resets after you have been out of a hospital and skilled nursing facility for 60 consecutive days. If you are readmitted before that 60-day window closes, you are still in the same benefit period, and you may owe a substantial copayment. In 2025, the Medicare Part A skilled nursing facility coinsurance for days 21 through 100 is $209.50 per day. Here is the human scenario. Your mother was discharged from rehab in February. She came home, seemed stable. Then in April, 45 days later, she had a fall and was readmitted. The family assumed Medicare would cover it just like before. It did not, because she never crossed that 60-day gap. The same benefit period was still open. And starting on day 21, the family was receiving a bill for $209.50 every single day. What most people don't know is that you can contact the facility's billing department and request a Medicare Secondary Payer Questionnaire review. In some cases, if a supplemental Medigap policy is in place, it will cover the SNF coinsurance entirely. The action step. Before any SNF admission, call your Medigap plan or call 1-800-MEDICARE and ask specifically whether your current benefit period is still open. Ask them to document that answer. Get a reference number for the call. Number 3, The homebound definition that locks out home health care. Medicare covers home health services, nursing visits, physical therapy, occupational therapy, but only if you are considered homebound. And the definition of homebound is far stricter than most people expect. Homebound does not mean you never leave the house, but it does mean that leaving your home requires a considerable and taxing effort, or that you need the help of another person or a device to leave. Here is where people lose coverage. You mentioned to your home health agency that you drove to church last Sunday. The agency marks you as no longer homebound in their documentation. Your Medicare coverage for home health stops. You find out when the bills start arriving. In 2025, a full course of home health care, nursing visits, therapy, aid services, can cost $4,000 to $7,000 out of pocket without Medicare coverage. Verify 2025 home health cost ranges. What most people don't know is that a single trip to a medical appointment, a trip to get a haircut, or attendance at a religious service does not disqualify you from homebound status. The CMS guidelines specifically allow for these infrequent, short-duration absences. The action step. If your home health agency tells you that you no longer qualify as homebound, request a written notice of the specific documentation they used to make that determination. Then request a redetermination from your Medicare Administrative Contractor, your MAC. Call 1-800-MEDICARE and ask for your MAC's contact information for home health redeterminations. Number 4, the hospital observation status trap. This one costs people thousands of dollars, and Medicare does not warn you when it is happening. When you are admitted to a hospital, you are placed in one of two statuses, inpatient admission or observation status. The difference sounds administrative. The financial consequences are enormous. If you are on observation status, even if you spend 3 full nights in a hospital bed, Medicare Part A does not cover your stay. Part B covers some services, but you pay 20% coinsurance with no out-of-pocket cap. More importantly, Medicare will only cover a skilled nursing facility stay if you had a qualifying 3-day inpatient hospital admission first. Observation status does not count toward those 3 days. Here is the scenario. You are admitted after chest pains on a Thursday evening. You spend 4 nights in the hospital. You are discharged Sunday and transferred to a rehab facility for recovery. You assume Medicare covers the rehab because you were hospitalized for 4 nights. Then you get the bill, $12,400. Your hospital stay was classified as observation status, not inpatient. Medicare Part A does not cover any of it. As of August 2022, the Notice Act requires hospitals to notify patients in writing within 36 hours if they are being placed on observation status. This is called the Medicare Outpatient Observation Notice, or MOON. What most people don't know is that if you were not given this notice, you may have grounds to dispute the status classification. You can request an inpatient admission review by contacting the hospital's patient advocate directly and asking to speak with the physician responsible for your admission order. The action step. Every time you or a family member is admitted to a hospital, ask within the first hour, am I admitted as an inpatient or am I on observation status? Ask for it in writing. If the answer is observation, ask what is needed to convert the status to inpatient and whether your attending physician has reviewed that question. Stay for number 6. It is a single form and a 10-minute phone call that can be the difference between paying a $6,000 denial out of pocket and having it covered in full. Number 5. The mental health coverage gap. Medicare covers mental health services, psychiatry, therapy, counseling. But the reimbursement gap between what Medicare pays and what providers charge has created a quiet access crisis for seniors. Medicare Part B pays 80% of the approved amount for mental health outpatient services after your deductible. The 2025 Part B deductible is $257, but many therapists and psychiatrists do not accept Medicare assignment, meaning they charge more than Medicare's approved rate. If your provider does not accept Medicare assignment, you can be billed up to 15% above the Medicare approved rate, and Medicare will not cover that excess. Here is what this looks like. You have been seeing a therapist for anxiety and depression management for 6 months. She raises her rates in January. She is now charging $180 per session. Medicare approves $110. You owe 20% of $110, plus the $70 gap, $92 out of pocket per session, every week. That is nearly $400 per month in uncovered mental health costs. What most people don't know is that federally qualified health centers, FQHCs, are required to accept Medicare and charge on a sliding fee scale based on income. The action step: go to findahealthcenter.hrsa.gov. That is the Health Resources and Services Administration's locator, and enter your zip code. Every center that appears is required to see you regardless of your ability to pay and must accept Medicare. This costs nothing to look up and takes 3 minutes. Number 6, the Medicare Savings Program you are almost certainly not enrolled in. This is the one most people never find out about. Medicare Savings Programs, MSPs, are state-administered programs that pay your Medicare Part B premium, your Part A premium if you have one, and in some cases your deductibles and coinsurance as well. In 2025, the standard Medicare Part B premium is $185 per month. If you qualify for even the lowest tier of MSP, the Qualified Medicare Beneficiary Program, or QMB, the state pays that premium for you, entirely. That is $2,220 per year you are currently paying that you may not have to. And it goes further. QMB also prohibits providers from billing you for Medicare cost sharing, meaning no copays, no deductibles, no coinsurance on covered services. Here is who qualifies. In 2025, the income limit for QMB is approximately $1,275 per month for an individual and $1,724 per month for a couple. Asset limits vary by state. Some states have eliminated the asset test entirely. Here is the human moment. A retired postal worker in Ohio has been paying $185 every month for her Part B premium since she turned 65. She is 71. She has paid $13,320 over those 6 years. Her monthly Social Security check is $1,190. She qualifies for QMB. She has for years. Nobody told her. The SSA does not automatically screen you for Medicare savings programs when you enroll in Medicare. Your Medicare Advantage plan does not tell you. The state does not contact you. The program exists, the money is there, and almost nobody who qualifies actually applies. The action step is a single form. Contact your state Medicaid office. You can find it at medicaid.gov/state-overviews, or call your state health insurance assistance program, SHIP, at 1-800-MEDICARE and ask them to connect you to your local SHIP counselor. The counselor will review your eligibility for free, complete the application with you, and submit it on your behalf. This takes 1 phone call and 10 minutes. If you qualify, the benefit starts the month after your application is approved, and in most states, it can be applied retroactively up to 3 months. Here is a rapid summary of everything we covered today. 1. Know the words expedited appeal when Medicare Advantage denies your care. Use them within 72 hours if the denial affects your health. 2. The 60-day SNF gap rule can trigger a $209.50 per day coinsurance. Call before any skilled nursing admission to confirm your benefit period status. 3. Infrequent trips to church or a haircut do not cancel your homebound eligibility for home health coverage. Know this before your agency documents otherwise. 4. Ask within the first hour of any hospital admission whether you are inpatient or on observation status. Get the answer in writing. The financial difference can exceed $12,000. 5. Federally qualified health centers at findahealthcenter.hrsa.gov must accept Medicare and offer sliding scale fees. If you are paying out of pocket for mental health care, look this up tonight. 6. If your monthly income is under $1,275 as an individual, call 1-800-MEDICARE and ask your SHIP counselor to screen you for the QMB Medicare Savings Program. The Part B premium alone is $2,220 per year you may not need to be paying. Subscribe to this channel and pass this video to someone you know who is on Medicare and has ever had a claim denied, a bill they couldn't understand, or a coverage question they didn't know who to ask. One conversation, one phone call can change their financial situation for years. I'll see you in the next one.